My name is Dr. John Stone. I'm a rheumatologist at the Mass General Hospital in Boston and a professor of medicine at Harvard Medical School in the United States. In our last video, I introduced you to IgG4-related disease. To summarize, IgG4-related disease is an uncommon condition, officially classified as a rare disease, that affects about 1 individual in 8,000. IgG4-related disease can be serious and lead to damage in a variety of different organs. The most affected organs are some of those in the head and neck and the pancreas. The disease cannot be cured presently, but we can usually control the disease flares effectively. Disease flares are occurrences of disease activity, waves of injury, if you will, that can lead to damage within the affected organs. In this video, we review some of the frequently asked questions I hear from my patients. Let me introduce you to Dr. Shauna Quinn. Shauna is a scientist from Zenas Biopharma who studies IgG4-related disease. She will start off today's video with the first frequently asked question.
The cause of IgG4-RD is not known, but we suspect that genetics makes some individuals more susceptible to getting the disease. Environmental exposures may also be important. For example, a past infection or a medication could act as a trigger in the susceptible individuals. But to our knowledge, there is no evidence that lifestyle issues such as smoking or being sedentary contributes to IgG4-related disease. Increasing evidence suggests that IgG4-RD is an autoimmune disorder. Auto means self, and the immune system is the body's organ that has evolved to fight infections, ward off invasions from parasites, and so on. So the essence of an autoimmune disorder is that the body's own immune system, for reasons that remain unclear, stage a misdirected attack against a patient's organ. The immune system is a complex assembly of cells and inflammatory proteins that work directly by engulfing an invader or indirectly by making antibodies. Antibodies recognize invaders and target them for destruction. It is this part of the immune system that we believe is mistakenly attacking your organs. IgG4 is the name of a type of antibody. All people, whether sick or healthy, have antibodies because antibodies are an important part of the immune system. In IgG4-RD, for reasons that are still not entirely clear, patients usually develop levels of IgG4 antibodies in their blood that are very high. Why do we think that IgG4 is important? There are several lines of evidence suggesting that IgG4 is important in this disease. One of them is that biopsies of organs affected by IgG4-related disease show abundant numbers of IgG4 carrying cells that have infiltrated into involved tissues. One of the mysteries about IgG4 that persists is whether IgG4 is causing harm or attempting to prevent harm. An analogy that helps understand this puzzle relates to what an observer might see at a fire. At the scene of a big fire, one is likely to see many fire trucks. It would be a mistake to conclude in that situation the fire trucks are causing the fire. The same is true potentially with the case of IgG4 in IgG4-related disease. It is possible that IgG4 in this setting is attempting to exert a protective effect. It is clear that we still have some more important things to learn about what makes IgG4-RD tick. One thing is clear, however, IgG4 is a good biomarker for IgG4-RD. That is, when the serum IgG4 levels is high and rising steadily, this usually means that the disease is active. From our first video, you know that IgG4-RD comes and goes in waves called flares. These flares are caused by autoimmunity or the body's immune system attacking itself. It is very important to control these flares to prevent organ destruction. Dr. Stone has successfully treated many patients with IgG4-RD and will explain his strategy. Your treatment may be different depending on your physician and the region you live in.
Thank you, Shauna. I typically start treatment with an old but effective class of medication called glucocorticoids. This group of medications remains the standard of care for the initial treatment of IgG4-related disease across the world. Prednisone is probably the best known type of glucocorticoid, also called a steroid, and prednisone is used as the cornerstone for treating many dozens of different diseases. Steroids work by slowing down multiple elements of the immune system, thereby contributing to the control of IgG4-related disease flares. Unfortunately, steroids affect not only the cells of the immune system that contribute to IgG4-related disease, they also literally affect virtually every cell in the body, good and bad. Because of the broad nature of steroids' effects, these medications can be associated with a host of side effects. Some of the common side effects of prednisone are high blood pressure, glucose intolerance, increasing a patient's risk for diabetes, insomnia, mood swings such as depression or mania, an elevated risk of bone fracture through a disease called osteoporosis, a heightened risk of infection, skin changes such as acne and easy bruising, eye problems such as cataracts and glaucoma, and on and on. All of these prednisone side effects make one reasonably wonder, is the treatment worse than the disease? Although prednisone is effective in controlling IgG4-related disease, at least in moderate doses, the side effects of steroids are one reason that the identification of new treatments for IgG4-related disease is such a high priority. We also try to limit the duration of treatment. Often a several-week course of steroids is sufficient, and then we try to taper the steroid off completely. This is the best way to quickly control a disease flare while minimizing side effects. If steroids don't work, or if patients experience another disease flare after the prednisone is tapered to a low dose, then there are other options for treating the disease as well. I will cover these in future videos. As a patient, it's important for you to know that your doctor can work closely with you and control your disease, at least initially, with a high likelihood of success. This is great news. As of today, however, there remains no cure for IgG4-related disease. The search for better treatments and for a cure is what motivates many individuals studying the problem of IgG4-related disease today. There is no doubt that arming a patient with information about his or her disease is almost as important as the treatments I provide. These videos are meant to empower you to know your disease and participate in your treatment with your medical team. Please refer to the links in our video description for a list of patient advocacy groups, clinical trials studying new therapies, and other patient resources. Thank you for watching, and I look forward to speaking with you again soon.